a lot of people just come to me and say, you know, I need to look better. I want to look younger. So Botox and fillers is the easiest way. It's like the first step, and you can make somebody look, you know, modestly better just by removing, you know, improving the nasolabial folds, helping some wrinkle lines, you know, making the frown line less apparent. I think all those things are easy things.
Typically we'll do our filler treatments in combination with Botox because we find that by relaxing the muscles around the areas treated with the injectable, we find that enhances the duration of the effect. So let's say we're injecting some forehead lines with a filler, then following that up with a Botox treatment to relax the muscles around the lines, it's going to enhance the longevity of the filler product. So the two work well in combination with each other.
Botox is one of the biggest, it's probably the single biggest cosmetic procedure in the USA and probably worldwide.
We use Botox to treat dynamic lines, lines that move as a result of muscle movement. We inject the Botox below the skin, and this relaxes the muscles. The lines are much more noticeable.
Botox, true, is not a long-term solution, but it's not correct that Botox is something that's a substitute for surgery. Surgery only removes extra tissue or picks up something which has fallen. It doesn't help with crow's feet. It doesn't help with wrinkles when we smile. So when we recommend Botox injections, it's to accomplish something that we cannot accomplish with surgery or other means.
Fillers are great for areas that have volume loss, nasolabial folds, the marionette lines. You can actually make the jawline a little bit sharper by filling in here, and if someone's cheeks are sunken in, you can put filler into here to plump them back out.
The ideal filler is a filler that's malleable, inert, can be injected through a 30-gauge needle, is painless, and looks natural. The closest to that is a hyaluronic acid. The Juvederm family, Restylane, or Perlane are really the leaders in that area. But there's some very good volume fillers. Radiesse is a lovely product that's getting tremendous traction and growing by leaps and bounds every month. And Sculptor just approved by the FDA for volume filling in an aesthetic patient.
Small amounts and combination treatments I think work better than any one treatment on its own. So my favorite thing to do is to combine laser treatments with fillers, with Botox. All of these different things in the arsenal I think give a better result without looking unnatural.
Fillers and Botox is like the first step, and certainly in a recessionary time like we have now, I think people are more likely to be able to afford these little procedures.
It's been well cited that there's patients who have had Botox that's actually not FDA approved official Botox, or filler that has been done in other countries composed of materials that your body ends up having a reaction to. These are all patients that end up with complications that cause them not only a financial issue but also a health issue.
You know, the tell of a really good physician is somebody who can do this in a natural way. And so word of mouth is important, and you know, do your homework.